Mina Aissatou Smile Cisse. As the Ministry of Health and Sanitation, they continue for give status updates about the COVID-19 at the country. Sierra Network then at the National Emergency Operations Center concerning the status updates. Let we listen to Solomon Kolka as they give the updates.
Gentlemen and members of the press, we want to take this opportunity to welcome you all to today's press briefing. Before we go further to the press briefing proper, I want to take the opportunity to introduce the pillar leads that are very critical to this response. I want to start by introducing Professor Fodisa, who is here representing the lab. And we have Mr. Charles Kimbe, representing surveillance. And we have Mr. Idara Bangura, Colonel Idara Bangura, who is representing the operations pillar. So before going further, I want to take this opportunity to apologize for the absence of the official spokesperson, Mr. Solomon Jamiru, and the risk communication pillar lead, both of whom are in the provinces on a critical assignment, similar to what we're here doing. But we are not going to leave any gap. Today we have the Chief of Staff with us, who is ably and aptly going to step into the shoe of Mr. Solomon Jamiru, who is no less a person, but Mr. Solomon Kolka. Coincidentally, Solomon Jamiru is not here, but we have another Solomon who is going to act in that capacity. So I will now hand you over to Mr. Solomon Kolka to read the press statement with him. Then we'll have sessions for questions for members of the press, 5 questions though. Then we go to the end of today's press briefing. Thank you very much. Over to you, Chief of Staff, Mr. Solomon Kolka.
Thank you very much, Musafika, for that introduction. And good morning, everybody. Like I said, I'm stepping in for the spokesman and the usual press briefing team. And we are to update you on the status for COVID-19 as at 25th April 2020, 11 a.m. As a matter of fact, we have passed 11 a.m. It's about 11:14 now, but the update remains valid. Total cumulative confirmed positive cases stands at 86. The total number of deaths is 3. Active new cases, 4. Active cases in isolation centers, 73. The general condition of confirmed cases remains stable. Cumulative recoveries is 10. Number currently in quarantine is 889, that's 889. And then the number discharged from quarantine stands at 1,267. 1,267. There's a little update that's added to this to say that the Chinese P3 lab is temporarily closed due to the recorded positive cases. I think there are a few positive cases that have been recorded today. You will have more details on that as we proceed. This is the update for 25th April 2020. That is as I'm speaking now. Thank you very much.
So I want to thank the Chief of Staff for that update. Members of the press are now welcome to ask salient questions regarding to the response.
The floor is open now.
The floor is open for questions. Those online, those in the building here.
Jonathan Turner from SNSC. So why the closure of the Chinese lab at Joy?
Okay, thank you. Doctor, can you take that?
Yeah.
Yes.
2 members of their team actually tested positive. That is one of the technicians and the cook of the team. Both of them tested positive. And since the rest of the team have interacted with these 2 positive cases, go, the entire team has been quarantined.
Does that answer your question?
Yes, sir.
Thank you.
Any more questions?
Yes.
Yep.
I started Smile from Sierra Network Place. Yesterday we recorded 2 deaths and today is 3 deaths. I want to know if this one death was hospitalized in any hospital.
Well, the death that is being reported today is the only death that has occurred in our treatment center. The previous deaths have occurred at Connaught Hospital, where they went in for other ailments and then tested. But this is the only confirmed death from our treatment center. And this person also is a 60-year-old male who was dependent on dialysis. He was dependent on dialysis 3 times a day, but since he could not get the services, I'm sure, we expect that is the death that has been reported.
Thank you. Next question, please.
Any other questions?
The 4 new cases, where are they from?
Sorry?
The 4 new cases, where are they from?
Which 4 cases?
4 new
The
cases.
4 new cases.
Yes.
They have been, fortunately for us, these are people that have been in quarantine. So they have been under our watch. These are contacts of our previous cases. They have been in quarantine, and those are cases.
Any other questions? From last lucky callers? We're expecting 2 more questions. If there are no more questions, then we're going to come to, yes? Speak a little bit louder, please.
And cover your mouth with mask.
I get for this very news agency, and I actually want to know, since then we have started, registering total number of the death cases. Are there any mechanism, trying to put in practical, for where lives of people could be saved?
Prevention.
Well, before the doctor speaks on that, I think generally you will agree with me that the fatality rate for COVID-19 is not that high. Many people who get infected eventually, if they are well taken care of and they don't have other serious ailments in their systems, eventually recover. And our treatment facilities are making sure that they provide the best care possible for patients until they recover. And you have also seen that in the past days, people have been discharged successfully from hospital. Or maybe there's a more scientific detail that Dr. may want to add.
I really got any more science in the subject.
Okay. Right.
So I think Mr. Kembe may want to add to that. Then after his speech, then we can have one question from guys in the social media.
Yes, thank you very much. He was asking about mechanisms. First, we have the alerts. Alerts are being reported to the case investigation desk. We'll investigate any case, and we have the case management. All those structures are in place. We have the hospital, we have the other one in Hungary. They are all gathered towards taking care of COVID cases.
Good. Thank you very much. The 2 questions I have here, in fact, they are no questions, they are concerns. One of them is saying we should stop touching your faces. Stop touching your faces. And the one is asking why was this press conference or press briefing why was it delayed?
All right.
Yeah.
Okay, so we have generally been taken through the proper use of masks, and I'm sure the public has also been engaged on how to use masks properly. So firstly, it's not only about using the mask, it's about using it properly. And I'm not sure since we came in here, anybody has actually touched this mask, except maybe behind me. I didn't see anybody doing that. But if you do that by mistake, because naturally as human beings, all the time we have a tendency to put our hands in our faces. The moment you do that, instantly sanitize your hands. That's the message. You may even do it unconsciously, but just every 15 minutes or so, you may want to sanitize your hands. If you don't have sanitizer, you can go wash your hands as often as possible to make sure your hands are not infected. And the second question about the briefing not starting on time, but of course, we all know sometimes there are intervening emergencies that come in that you have to attend to first. before you ensure that you do the next activity. So today there was something we needed to update in terms of giving you the most current details for today, which delayed the whole press conference. But that's basically about 15 minutes late, which I think is, in the current circumstances, acceptable.
So I think if there are no more questions, I will now hand you over to the Chief of Staff to give his closing remarks. Then that ends today's daily press briefing.
All right, so thank you, colleagues, for coming. This briefing is important because this is the route through which we get to the public, in addition also to the Ministry of Information briefings. Whatever you record here is what you put in your publications, in your bulletins, so that the public is fully updated on the COVID situation in the country. So it is important that we maintain this tempo and bring in as much questions as we can each time there's a session, so that we clarify things and the public is not misinformed, or the public is not left to make its own conclusions, which is always dangerous in circumstances. So thank you very much for turning up, and let's look forward to the next press briefing. Thank you very much.
Hello, welcome to this interview. Your name and TV.
Okay, me na Professor Fodisa, na me na the technical lead for the COVID response.
Okay, we see Salon don't record another one case. We don't go to 3 death case where we don't record. And I go want to know when this patient be taken to the hospital.
Well, this patient we died in Crown Hospital yesterday. Now a 60-year-old male we dependent on dialysis. He's supposed to do dialysis 3 times a week. Then Karanguna yesterday, he's supposed to do dialysis yesterday, but unfortunately the facility where they actually offer the dialysis service, they refuse to take the patient in. They say the patient COVID positive. So that patient, so he died overnight.
So that patient is also every day?
At 34 Military Hospital.
Now, was he come out from quarantine homes or be just dinner homes?
Well, this patient, not from quarantine home. Now from one of the contacts them, we've been record one of the case them we be the going at the same dialysis center we prove positive. So all the one that will be going at that place there, now they will be the follow up. So itself can prove positive. So now we take them in at 34 hospital.
So what's the status right now for the other patients within the hospital?
The other patients them all very stable, as we all know. Just like what happened on the other side of the world, if somebody gets other ailments like cardiac problem, diabetes, any other illness, it increase in chance of mortality. But fortunately for we, most of the patients that we get, 80 to 90% of them, they're very stable, and as I speak, they're very stable now. All 3 treatment centers.
So what's the message you go add to all what you don't say so?
Well, the only message I go add, and follow all corporates, follow make sure say we fight COVID. Then give we 3 messages. 1, use mask when they go out in public. 2, maintain social distancing. And 3, frequent hand wash. I should say if we keep to them 3 rules, them we will be able to save ourselves and we immediate families them.
Okay. Thank you very much.
Thank you, ma'am.